All right, today we're going to tackle one of the most talked about and honestly one of the most misunderstood diseases out there, Lyme disease. We're going to break down the science from that tiny little tick all the way to treatment and prevention, all based on solid research. So let's jump right in.
To get us started, I've got a question for you. When you think about diseases you can get from a bug bite here in the US, which one do you think is at the very top of the list? Take a second, think about it.
If you guessed Lyme disease, you are absolutely right. It is by far the most common. And here's the part that's kind of mind-blowing. The tick that usually gives it to you can be as small as a poppy seed. Seriously, it's a tiny, tiny threat that's become a huge public health issue.
So let's start right there. Let's really get a handle on the scale of this problem. Just how common are we talking about?
Well, get this. The official numbers you see might be around 30,000 cases a year. But the CDC estimates the real number is probably closer to 300,000. That's a tenfold difference. It just goes to show you how many cases might be missed or misdiagnosed, especially since the early symptoms can look like so many other things. So what is Lyme disease exactly? Well, it's a systemic illness, and that's just a way of saying it doesn't just stay in one spot. It can travel through your body and affect all sorts of things, like your skin, your heart, your joints, and even your nervous system. And here's a really key distinction to make. You have the culprit, and you have the delivery system. The tick itself isn't the problem. It's just the vector. It's the messenger. The real culprit is a spiral-shaped bacteria called Borrelia burgdorferi. The tick picks it up from animals like mice, and then, well, it passes it along. Okay, so now we know what causes it. But how do you know if you have it? Let's talk about the signs, the clues your body gives you. The most famous sign, of course, is that classic bullseye rash. Its technical name is erythema migrans. It usually pops up a week or two after the bite, gets bigger over time, and often clears up in the middle, creating that ring shape. But here's a super important detail. The rash usually isn't painful or itchy, and that's a big reason people might miss it. For a doctor, though, seeing this rash is basically a slam dunk for a Lyme diagnosis. Now, if Lyme isn't treated, the infection can kind of progress. In the first few weeks, you get the rash, but a few weeks or months later, the bacteria can spread, and you might get flu-like symptoms, facial palsy, where one side of your face droops, or even heart problems. If it goes on even longer, months or years later, you can end up with some serious arthritis, especially in big joints like your knees. But here's the thing. Not everyone gets that rash, or maybe they just don't notice it. So what happens then? How do doctors figure it out? Right? It's the big question. If you don't have that bullseye, how can you be sure? Well, it becomes a bit more like detective work. Doctors have to piece together clues from your symptoms, where you might have been exposed to ticks, and, of course, they turn to lab tests. The standard way to do this is with a two-step process. First up is a screening test called an ELISA. It's really sensitive and looks for the antibodies your body makes to fight the infection. If that test comes back positive or kind of borderline, then they move to step 2, a more specific test called a Western blot, which confirms the result. It's like a 1-2 punch to get an accurate diagnosis. But here is a huge catch, and you really need to remember this. Timing is everything. It can take your body a few weeks, maybe even up to 6 weeks, to produce enough antibodies to actually show up on a test. That means if you get tested too early, you could get a negative result, even if you are in fact infected. Okay, so let's shift gears to the good news. Because the really good news is that once it's diagnosed, Lyme disease is very, very treatable. Let's look at what recovery looks like. For the vast majority of cases, standard antibiotics work incredibly well. If you catch it early with the rash, a simple 10 to 21-day course of an oral antibiotic like doxycycline usually clears it right up. For later stages that might involve arthritis or your nervous system, you might need a longer course, or sometimes doctors will use IV antibiotics to get the medicine into your system more directly. But the key takeaway here is that at every stage, the cure rates are super high. All of this can sound pretty scary, which brings me to this quote from Dr. Leonard Segal that I think really hits the nail on the head. He says that while Lyme is a real problem, the anxiety and fear surrounding it can actually become a bigger problem than the disease itself, which, again, is highly curable when it's treated properly. Now, you may have heard of people who have symptoms like fatigue or joint pain that stick around for months after treatment. This is sometimes called post-Lyme disease symptoms. The crucial thing to understand is that this happens after the infection has already been cured. And study after study has shown that taking more and more antibiotics doesn't help these symptoms and can actually be harmful.
And that brings us to our final, and I'd argue our most important section, your prevention playbook. Because the absolute best way to beat Lyme disease is to not get it in the first place.
If you remember one number from this whole explainer, make it this one: 36 hours. Research shows that an infected tick has to be attached to you for at least 36 hours before it can transmit the bacteria. That's a huge window of opportunity. If you find and remove a tick quickly, your risk of getting sick plummets.
So before you even head outside into the woods or tall grass, think ahead. Use a good repellent on your skin. Even better, treat your clothes and your gear with something called permethrin. It actually kills ticks that come into contact with it. And simple tricks like wearing light-colored clothes so you can spot ticks easier and tucking your pants into your socks, they really do help.
And the job isn't over when you get back inside. Try to shower within 2 hours. That can wash off any ticks that haven't latched on yet. Then do a really thorough, full body check. And a great final step is to toss your dry clothes into a hot dryer for about 10 minutes to kill any stowaways. And that leaves us with one last really interesting thought to chew on. You might be surprised to hear that there actually was a human vaccine for Lyme, but it was taken off the market way back in 2002. So what's next? Well, scientists are working on some pretty cool new ideas, from better vaccines for us to maybe even vaccinating the mice that carry the disease in the wild. It's a fascinating area to watch. Thanks for joining me today.